Firstly, in this situation, Rachel needs to find out exactly how urgent the blood tests are, and she needs to consider the Mental Capacity Act and best interests. In this point, Rachel should intervene to prevent the intervention from going ahead. She should consider, is it possible to introduce the blood test slowly? And to do this, she could go through the CAPT tool from Brodhead's paper. She needs to make it clear what to try and how long they should try it for. At what point is that intervention not working and they now need to move on to using restrictive interventions. For this, Rachel will need to consider two aspects of the code in particular. Firstly, 4.09, which is around using the least restrictive procedures. By introducing blood tests slowly, that's clearly using the least restrictive procedure. The next one that she needs to consider is 1.04, integrity. Section B states that behaviour analysts do not implement contingencies that would cause others to engage in fraudulent, illegal or unethical conduct. Holding someone down without considering the Mental Capacity Act and best interests goes against UK law and legislation. The next bit is also 1.04, integrity. Section D. Behaviour analysts' behaviour conforms to the legal and ethical codes of the social and professional community of which they are members. So Rachel herself needs to consider, is she acting within the best interests of this client? Within Rachel's examples, we've clearly shown that at some points you have to intervene to prevent an intervention from going ahead. But how do we do that without compromising our professional relationships? Firstly, we need to consider the context and relationships that we have with our colleagues within that MDT. The way that we might approach it with a team that we have a long history of working with is very likely to differ from a team that we've only just started being part of. If we need to intervene, it's also important that we consider that we don't just stop that intervention from going ahead. We consider what the alternatives are. We give that alternative and state that we can collect data which we will share with the team to find out if it is actually effective for our client. We need to refer to the evidence. What is the research showing? It's important here that we show that rather than just saying, I think this intervention isn't effective. We can use the flowchart from Brodhead as well to conceptualise our thinking to evidence why this is the case. We can then also consider the level of evidence approach, systematic review being one of the most rigorous levels of evidence. What is that showing? And then we go right down to case studies without experimental control, which shows that actually if that's the evidence, that's not effective. We need to review the intervention regularly and collect data. We also then need to consider, has there been a mental capacity assessment in relation to this? If the person has capacity and they want that intervention, they have the right to make an unwise decision and we have to respect that. If the person is assessed to lack capacity, then we go down the best interest route and we can contribute towards that. But ultimately, we don't have the final say. In some cases, we might need to consider that we discharge a person from our caseload. And if we find that this is the case, then we need to consider section 4.11 from the compliance code, which is around discontinuing behaviour change programme and behaviour analytics services to make sure that we do this in an ethical way. Thank you for listening to this video around how we as behaviour analysts can effectively work within an MDT.
Thank you for watching our Wise Bites videos. This CU should have taken you 1 hour and 15 minutes. If it hasn't, there are some resources below for you to have a little look at to make up their extra time. Do take a look at some of our other Wise Bites videos on our website. Thank you.